Earlier, a health screener at LAX airport tested positive for the virus. It's not clear if he or she may have exposed others. On the East Coast, 1,000 people have now been asked to self-quarantine in New York, including hundreds who are potentially exposed at a synagogue last month.
It's inevitable that it will continue to spread.
While experts maintain the risk of contracting the coronavirus is low, many are skipping travel plans. With business plummeting, United Airlines slashing domestic flights by 10% next month and scaling back its international trips by 20%. JetBlue also officials cutting in King County, which includes Seattle, are recommending but not mandating that residents at higher risk stay home and avoid crowds. They're also urging businesses to find ways to allow employees to work remotely. Amazon responding by telling its Seattle staff to work at home for the rest of the month. Tech giant Microsoft taking similar steps with its employees in both Seattle and San Francisco. While one of Seattle's most iconic companies, Starbucks, doing its part to prevent the spread of the virus, temporarily suspending the use of personal cups at its stores nationwide.
Remember that schools and universities in the north of the country, areas which have been hit the hardest by the coronavirus, have been closed for a number of days already. Now it appears the government has taken the step to close them across the country. Some people say the government has really acted far too slowly. It should have taken much more stringent measures earlier on. Others say no, it did take stringent measures. It locked down some of the towns in the north, these 11 towns in the north where the outbreak was first detected. And other people say, yes, we're worried about this in terms of health, but what about our economy as well? This is having a terrible impact on business here, on tourism. So you have very, very varying ideas, and now that it seems that children won't be in school, there will be questions about childcare issues, what that means for people going about their day-to-day work. Many, many questions here, and people very, very uncertain as to how long this is going to go on for and what it's going to do to their country.
Now, the number one thing to avoid getting sick is simply to wash your hands regularly. They say wash your hands for a good 20 seconds or so. Avoid touching your face. We all have a tendency to want to scratch our face or whatever the case may be. But as soon as you do that, if you've got a contaminant on your hand, you can spread it to your eyes or your nose or your mouth. So that's a problem. Avoid close contact with people who might be sick. And then, of course, if you yourself are sick, then try to stay home.
Those cases backflow cases. Those are the people who contracted the virus outside China and bring it back. The 8 Chinese workers returned from Italy worked for the same restaurant, and they are all from the city of Wenzhou. 6 of them traveled via Moscow to Shanghai and on to Wenzhou. 1 case flight through Germany. The Chinese authorities are worried about those cases. They have traced down a dozen of people who has had contact with those workers returned back. There are an estimated 100,000 Wenzhou workers in Italy. China worries about those backflow cases, as 2 cases confirmed in Beijing recently are people returned from Iran. There are at least 5 backflow cases in China now, and the number is still increasing.
Halting education nationwide from preschool to university. Italy's Prime Minister says the country is fighting with all measures against COVID-19. Giuseppe Conte says we felt it was the right thing to do to suspend educational activity until the 15th of this month. This parent says, I completely agree, and I hoped for this decree because I feared an outbreak in the school. The military is preparing to help care for those who are ill. It shared video from multiple sites being set up. The Italian government warned that no matter how good the health system is, it is at risk of being overburdened. A 3rd red zone is being considered to restrict the movement of people in hopes of slowing the spread of the virus. And there are plans to ban public events and shut down movie theaters, measures that could be in the near future for UK residents.
There's a run on supplies this morning. Big box stores across the country are seeing the growing concern over the coronavirus here, in the longest lines they've seen in years.
I'm in panic because I went to Costco and there's no water.
These are pictures posted online from various Costcos. and a line just as long outside a store in Brooklyn. At this public supermarket in Fort Lauderdale, they were doing double takes over this, seeing a shopper who was either kidding or taking the coronavirus fears very seriously, dressed from head to toe in a hazmat suit while getting supplies at the grocery store.
The end of the line for the toilet paper and paper towels is right here.
From coast to coast, even out in Hawaii, stores that were recently filled with bottled water, baby wipes, and toilet paper wiped empty.
We saw the mass
ingredients in medicines. Now, all of this comes as drug ingredient makers in China remain shut or have cut output amid the coronavirus crisis. Now, India's drug makers actually rely on China for nearly 70% of the active ingredients in their medicines. And industry experts have warned that they are likely to face shortages if this coronavirus epidemic continues. Now, analysts say that there are indications that the scarcity of the ingredients is already forcing up prices. But
Cold North Rocks, toilet paper aisle, absolutely none left.
So that's toilet rolls. Next, condoms, more empty shelves in Australia, in part, we think, driven by images like this, which apparently show people in Singapore putting a condom on their finger before they touch things like buttons in lifts. Now, it's very hard to establish whether this is really happening a great deal, but we do know condoms are definitely selling out in some places. And panic buying is also affecting hand sanitizers, face masks, goggles, to the great frustration of those who actually need this kind of stuff. Here's the US Surgeon General saying hoarding may pull from limited supply for hospitals, and this is what the International Monetary Fund is saying.
Cities like Los Angeles have also declared a public health emergency, which will trigger more state and federal funding to help deal with the outbreak. 11 people have now died in the U.S. There are more than 150 known cases across 16 states. The virus has also spread to America's biggest city. There are now 6 confirmed cases in New York City, including the first case of community spread. A lawyer in his 50s who works in Manhattan has COVID-19, and where he got it is not certain. He has spread it to others. New York's governor says the man's wife, 2 children, and a neighbor who drove him to the hospital, all of whom live in Westchester County, have tested positive. They're now at home in self-isolation, and the man is in critical condition in the hospital.
Become a label reader.
Okay.
The way you use it is you take basically put a bunch on your hands. You want to cover.
Show how much that was.
Yeah.
It was a,
this
like
is a
5
lot
pumps.
here. This
is that right?
Right, and because you want to be able to cover your whole hand.
Okay.
You work it through your fingers, and essentially you just keep working it until it's dry. It's going to take about 20 seconds to dry.
Oh wow, this is more than I would have used.
So don't stop rubbing until it's dry. And that's what happens is people tend to do this, and then they get to the point where it's not dry anymore.
Is the rubbing making it more effective?
It is, and it has to be on your hands for at least 20 seconds in order for it to kill the virus.
Okay. And then assuming you don't go dunk your hands into dirt, like how long does this stay effective?
Well, this will stay effective until next time you touch something, and then you get it on your hands. But the one thing to remember is, you're going to be doing this, and then the next thing you're going to do is you're going to pick up your cell phone.
Yeah.
That cell phone, who knows where that thing's been? So you want to make sure.
I've dropped my cell phone in the toilet before.
If you're looking at surfaces.
Oh, I'm not alone. I heard that.
And then you have to figure out how to pick it up. But if you're somewhere out and about and you're in public places, your keyboard at work, you want to clean them. There's 2 different ways. There's the sprays and the wipes. These essentially are made for this type of thing. And what the CDC says is regular household products will work, household cleaning products.
Lysol, whatever.
Right. But a lot of these you can see, they say on them specifically, especially the wipes, you'll kill 99.99%.